Hi, this is a brief demonstration of the Fugl-Meyer assessment of the upper extremity. Please ensure to test both the unaffected and the affected side for each of the sections. Section A, upper extremity, reflex activity. You'll be testing the biceps reflex activity by tapping on the biceps brachii tendon to elicit a response, as well as the triceps tendon. Part 2, volitional movement within synergies. You'll be bringing the hand from the contralateral knee upwards to the ipsilateral ear. Contralateral knee, ipsilateral ear. As you're going down, you'll be looking at the movements for the extensor synergy, and going up, you'll be looking at the flexor synergy movements. Part 3, volitional movement mixing synergies. Hand to lumbar spine. Shoulder flexion, 0 to 90 degrees. Pronation, supination, with elbow at 90 degrees, pronation, supination. Part 4, volitional movement with little or no synergy. Shoulder abduction, 0 to 90 degrees, with elbow at 0. Shoulder flexion, 90 to 180 degrees. Pronation, supination with elbow at 0. The following section 5, normal reflex activity, will only be conducted if your patient or client has scored a total of 6 points on section 4. Section B, the wrist. Stability at 15 degrees dorsiflexion with elbow at 90 degrees, forearm pronated. Ask your patient or client to dorsiflex at 15 degrees. Apply light resistance to see if your patient or client can tolerate the resistance. Repeated dorsiflexion, volar flexion. Again, elbow at 90 degrees. Repeated dorsiflexion, volar flexion. Stability at 15 degrees dorsiflexion, this time with the elbow at 0 degrees. Ask your client or patient to dorsiflex to 15 degrees. Apply light resistance to see if it can be tolerated. Repeated dorsiflexion, volar flexion, again, elbow at 0 degrees. Dorsiflexion, volar flexion. Circumduction, elbow at 90 degrees. Ask your patient or client to perform circumduction. Section C, the hand. Mass flexion from full or active passive extension. Here, you may provide support at the elbow to keep 90 degrees flexion, but no support at the wrist. So mass flexion, pass and extension. Mass flexion, mass extension. For the grasp, the hook grasp, ask your patient to demonstrate a hook grasp. You will come in with your hook grasp and apply light resistance to see if your patient or client can tolerate the resistance. Thumb adduction. You will have a piece of paper. Ask your patient or client to hold the paper between the thumb and digit 1, and you will gently try to pull it away from them to see if they can maintain the hold. Pincer grasp. Ask your patient or client to grasp the tip of a pen or pencil with the thumb and digit 1. Try to pull it away and see if they can maintain that hold. Cylinder grasp. Give your client or patient a cylinder-shaped object and ask them to maintain that hold as you try to gently pull it away. Spherical grasp. If you have a tennis ball, ideally, ask your patient or client to hold on to the ball and you try to pull it away and see if they can tolerate that resistance. Part D, or Section D, coordination, speed, testing for dysmetria. You will ask your patient or client to use the tip of the index finger and move from the knees to the tip of the nose with their eyes closed. Ask them to do this 5 times as fast as they can. Actually, first do it with the unaffected side, and you're going to time it, and then you ask them to do it with the affected side and time it as well. There you have it. That is your upper extremity assessment. Thank you.